Hey CE Impact subscribers, welcome back to part 2 of our series on the gut-brain connection. I'm your host, Josh Kinsey, and I'm excited to jump back into the conversation with Laura Zachariah as we continue exploring the powerful link between the gut and the brain. Let's jump into some of the opportunities for our pharmacists. So tell us what we could be doing to be better clinicians in this space. Like what should we be doing? Should we be asking certain questions? Should we be, you're the expert. I'll let you tell us what we should be doing, because there's so much information here and I feel like we could go in a lot of different directions, but I want to give the listeners, here are a few things you can do, and I'll let you go.
Yeah, I think I'm going to put it into 3 categories for us, right? We're going to talk about the education and the counseling opportunities and the little gems, little pearls that we can drop for our patients to help them become a little bit more aware and start making these connections. Category number 2 is going to be counseling points on those common medications that we talked about and opportunities to weave in some guidance. And category 3 is going to be, what are the other tools in our toolkit when it comes to supplement recommendations, lifestyle recommendations, or dietary recommendations that we might be able to leverage. And when that patient has the education and the awareness and the willingness to make those changes, we can also intercept with those options as well. We know a lot of patients, they're more interested in a holistic approach, right? We know that most of them, they want somebody that they can go to, that they can trust, that can give them recommendations when it comes to diet, lifestyle, that can think outside the box, that understands how their medications are impacting them, understands how to get the most out of their medication, and understands how to skirt some of the problems, the side effects that come along with those medications.
Right.
So what we're advocating for is actually the opportunity to be that standout pharmacist or pharmacy that can be their go-to, that can be that resource for them. And I don't know, that's kind of why I became a pharmacist, right? So here we go.
That's the root cause of it. Yeah.
It's kind of exactly, I don't know, it's up my alley. I feel like this is what pharmacy is all about. So being that problem solver, being that go-to community resource for our patients to, maximize their health, right?
Absolutely.
So number 1, counseling points. So we touched a little bit on this, but I think worth repeating again, that we want to make sure that when we're counseling, particularly if somebody comes to you because they are taking an SSRI, considering starting an SSRI, concerned about their SSRI, not getting the results they want from their antidepressant, right? That we ask the right questions. So number 1, I want you to be thinking about is, do they experience any GI symptoms? And this might have to be introduced a little bit to them because they may not be making that connection between their GI symptoms and their mental health. And there's a statistic somewhere about the incidence of depression and anxiety in folks who have IBS. And it's about 80% of patients who present with a diagnosis of IBS, and whether it be constipation dominant, mixed, or diarrhea dominant, about 80% also have either depression, anxiety, or both.
Wow.
So it's on us to make sure that they understand that there is a relationship between those two things, right? And to start paying a little bit more attention to their body if symptoms get worse when the other symptom gets worse. So their depression gets worse, does their GI symptoms get worse, and vice versa, right? So I think that's a great counseling point and a great opportunity to introduce a little bit of awareness to your patient and help them start to see if maybe some of the side effects they're experiencing to their gut might be interfering with their progress in terms of their mental health, right? And that could be from the SSRI itself, or it can be from another medication they might be taking. So going back to asking them a little bit more about what else are you taking? How do you, do you experience headaches, and how do you handle them? Do you have irregular cycles or irregular periods, and how do you manage that, right? Do you have painful PMS symptoms, right? Are you taking an oral contraceptive? What's your blood work? What has past blood work said about the health of your liver? Has that have you ever had issues with your thyroid? Have you ever had issues with your insulin? Do you experience insulin resistance? Do you have pain, joint pain?
Sure.
Right? Because joint pain is a marker of inflammation or causes more inflammation. Inflammation is also a driver of depression, anxiety, and GI issues, and vice versa. It's also sort of playing in that same pool and changing the microbiome, changing our immune response, and altering some of our hormonal signaling too. So all of these questions can start to, you're not necessarily even trying to get to a solution yet, but even just starting to explore and help them start to see the relationship and make the connections. Pain, joint pain in particular, is a very common manifestation of depression, right? And they might notice when their depression gets worse, their pain gets worse, and kind of almost reinforcing it's not in their head, and that it's a little bit of the chicken or the egg. The two are driving each other. And so that might be a way for them to really check in with their body and see how their depression is showing up physically and not just psychologically.
Yeah. Laura, I'm going to stop right here for 1 second.
Yes.
So we're at 30 minutes, but I feel like you still have a lot to give.
Yeah, I could probably do it in like 10 to kind of wrap up those 3 points.
Well, what I'm thinking is if you do it in like 10 and then maybe we have 5 minutes of like a debrief and whatever.
Yeah.
And I'm just going to make this 2 episodes. And right when you started saying I have 3 points to share, was that almost like the 23 or 24 minute
So
mark?
maybe that's like one.
So I'll just make it like, I'll be like, and come back for the next episode.
As long as you feel like it's good stuff. I'm totally cool.
Great stuff. So my only question was, are you okay to continue? Or did you have
I have time. Yeah, I always buffer myself. I know I talk a lot. So
well, let's just do that. I'm just going to make a note. No, this is great. And it's actually super helpful to get another episode out of it.
Great. Happy to, you know what? I was doing you a favor, Josh. That's
no, seriously, you are. Yes, very much. Okay. I'm just going to tell my person I'm just going to tell Allie to, cut out a little bit of that in the center. Okay. So let's start.
Let me just go back to 2. Something on my lips because I'm talking too much.
Okay, so we were at what was your second bucket that you
So the second bucket I was going to talk about I said medications and then lifestyle stuff. So bucket number 1 is counseling tips. Bucket number 2 are things that we could do when it comes to their medications.
Okay, I'm just going to say circle back to bucket number 2. Is that okay?
Okay. Yeah, go for it.
Okay. All right, Laura, that was great. That's so good. So now let's kind of circle back to the bucket number 2 that you mentioned before, some more of those, super great tips for pharmacists. So I'll let you have the stage again because you're just giving us so much good info. So have at it.
Thank you. So we talked a little bit in bucket 1 about kind of creating awareness, starting the conversation, starting to build that rapport with your patient.
Right. Asking the right questions.
Now, bucket number 2 may happen in the same conversation as those counseling points in number 1, or they might require a few contact points with your patient, depending on where they are. Because remember, when it comes to depression and anxiety, they're not always ready to jump right in with a change, right? It might feel overwhelming. They might not feel motivated in that moment. They might feel like they're a little lost, or they just want to do their own research, or frankly, they just want to wait on it a little bit. So it's really important to keep that.
Or they may not be ready to talk about it or want to talk about it.
Exactly. So, there's still a big stigma when it comes to mental health. And I'm finding that although we've come a long way, there's still a significant stigma and I find that patients, even when they start medication, they're often reluctant or there's a shame around it. Yeah. So just being able to talk about it in a way that doesn't shame them and that never makes them feel like the fact that they decided to start this, they're giving up, or even framing their
human, or it makes them changing who they are, or anything.
Right. Exactly. And so even when you're offering other solutions or you're offering complementary solutions, it's really important that we're sensitive in the way that we're presenting it. Not that it's a failing or it's a repercussion of the decision that they made to take or not take medication, but that rather it's just more options for them to make an informed decision about their health and to empower them. And I think that's a really, really important counseling point.
Yeah, I love that. Yeah.
So as we're transitioning then and thinking about the medications, we're going to start with the obvious thing, and that is the SSRI itself. Let's say they're taking an SSRI and they're not feeling like it's working optimally. You're going to do all the basics in terms of making sure that the timing is correct, that they are taking it consistently, that the dosage is appropriate, right? Making sure that it's at the correct dose. Sometimes there's a miscommunication. They may get started on a starter dose, but they've never gotten to their optimal dose, right? So just making sure all those things are in place, that they have the most appropriate SSRI class for their condition, and that they're also getting cognitive behavioral therapy or some access to some form of therapy, whether it be talk therapy, somatic therapy, etc., to complement that SSRI. I think to think that the SSRI is going to be this magic bullet that does all the work It's really more like a crutch that's going to get them to the point where they're ready to do the additional work that they need to do. And it's really important to remember that that is part of the guideline, and that is part of the counseling recommendation when it comes to using SSRIs. And this is your chance to jump in and say, okay, if you've been taking this now for 2 months, you're not experiencing benefits, I don't see a reason why it's not working, to make that recommendation to say, let's call your doctor and talk about an alternative medication or a secondary medication to address XYZ symptoms. Remember, that is your job as their advocate, as their pharmacist. So keep that in mind. Okay. Yeah. Number 2, if you have that conversation with them and it turns out that they've been taking a PPI for a really long time, or that they experience GI issues, they happen to have either IBS or GERD or some other GI issue, I think this is the opportunity for us to start to address that. So addressing and screening whether the PPI itself or the long-term use of that PPI is appropriate in that patient. There are situations where long-term PPI use is indicated. I'm not going to get into those. But if it turns out that they're using it because they have not been either fully evaluated, or they have been sort of using it as a crutch, or unaware of the fact that it's not intended for long-term use, and that there are repercussions on our microbiome balance, on our pH, on our ability to absorb certain nutrients, and that there are long-term ramifications and neurological ramifications associated from long-term use of PPI, this is your opportunity to gently educate them on that. And in my experience, a lot of people with depression and anxiety tend to also have GI issues. Again, it's that gut feeling. They're feeling it in their gut, and that very often they're not making that connection between those two, and they're not aware that there's alternatives. So I'll cover the alternatives in the lifestyle diet piece.
Sure.
But having that conversation deliberately about the use of PPIs, coming up with a plan or a protocol or a strategy to get them off the PPIs might be appropriate at this point.
Yeah.
Okay.
Yeah.
Now, number 3, NSAID use. This one is a big one because I find that a lot of people, again, they have depression, they're using a lot of NSAIDs, maybe they have hormonal issues because, again, your hormones, your sex hormones, particularly for women, if you're experiencing PMS, PMDD symptoms, et cetera, you're very often relying on NSAIDs in order to get through the day, frankly. Yeah. There's also a trend now, I'm seeing this a lot on social media, where women are resorting to using Pepcid, because Pepcid has we know it's not an antihistamine, but it has an antihistamine effect because it's a non-selective histamine blocker. And there's a relationship between excess histamine production and excess estrogen production, and that causes more PMS or more pronounced PMDD symptoms. So they're finding that using a Pepcid is a way for them to manage that. Again, similar to PPIs, it's not intended for long-term use. Some women only use it during the days leading up to their period. Some women are using it all cycle long. Some women also have GERD, so they're using it for their GERD, and they're finding it as like a 2-for-1 deal. So again, an opportunity to talk a little bit more about things that they may not think are related to their mental health, but are very much a driver, not only of their mental health, but of the decisions they're making around over-the-counter medications that might be having an impact on their gut health, that's then having an impact on their mental health.
Yeah. Yeah. Wow. And you think about, all the time, you hear someone say, that situation made me sick to my stomach, and so if you think about what that connection is, it's the anxiety or the fear of whatever was happening, and they literally get sick to their stomach because of that connection. And, whatever was happening, they get diarrhea or they get nauseous or whatever.
Yeah.
So yeah.
Exactly. Or that GERD, that reflex feeling that you get when you're really stressed out about something. I have found in my experience, I cannot successfully get somebody off a PPI or get them successfully managing their GERD until I get their anxiety under control, and vice versa.
I feel very seen right now, Laura.
I got you, Josh. I've
been on a PPI for a very long time, and every time I try to go off of it, I think also the anxiety of going off of it and what would happen probably makes it worse.
And also the GERD is sort of a symptom of the anxiety,
right?
Too.
That's what I mean. So, like it's just feeding itself.
And then you think about the reflux you're going to get when you stop the PPI, and that gives you anxiety, and then
exactly. So then I just stay on it. Yeah, exactly. And I have for almost a decade. So
exactly. And so
need to
So
get off.
that we're talking to you, Josh. Like
You
we are
are.
talking to
This
you.
whole conversation is mine. Yes, absolutely.
And this is why I think it just goes to show this happens to the best of us. This happens
Right.
to so many people, right? So it's very important for us to keep in mind that there's a lot of people that are getting diagnosed for depression and anxiety, but there's even more people that don't have that diagnosis that aren't even aware. So I keep talking about the people that are coming to you and are telling you and or from their prescriptions that they're suffering with depression or anxiety. But what about all the people that maybe it's just a little surface level? Maybe it's not significant enough to be considered diagnostically, right? Or
Or they're
maybe they're just
embarrassed to
dealing
mention it, or yeah,
they're embarrassed to talk about it, or they
hmm
think that they need to just get through
hold
it,
it
power
in.
through it, whatever, exactly, hold it in,
Hmm
toughen it
Right.
up, right?
Right.
There's all these people. So what an opportunity to then have a conversation about the folks that are telling you that they're always in pain, that they're taking a lot of NSAIDs. They're
hmm
telling you that, they've been on a PPI for a decade and they're afraid to get off of it because their GERD comes back. What an interesting opportunity to talk to them about their mental health and
Yeah.
what are the strategies that they're using to manage their stress, and what are the tools or the resources or the community that they have in order to help manage that stress as well.
Yeah. Yeah.
Right?
Super helpful. Super
Yeah.
helpful. All right. So you talked about a third bucket and you
Yes.
teased us with that. So let's talk about what is another opportunity for us as pharmacists. So what
Yeah.
places in that
So
bucket?
the third bucket happens to be my favorite bucket
Okay.
because to me, this is where we really have the opportunity to shine and to
Mm,
really show our patients something that they either may not be aware of or might be intimidated by. And that is the lifestyle piece. This is where we also can talk about diet with them. We can talk about habits with them, and we can talk about supplements and alternative medicine with them. And to me, this is what really sets apart a great pharmacist that has all the right counseling points, that can talk about drug interactions, and that can really like make sure that their patients are safe from a drug safety perspective, from an awesome pharmacist that not only can hold space for all those things and then take it to the next level and give them additional complementary, safe and effective advice.
mm,
So this is why this is my favorite bucket, because to me, this is really empowering, not to just us as pharmacists, but to our
mhm.
patients as well, that now can see you as this like awesome resource on their
Right.
healthcare team. Right.
Right. Yeah.
So now, number one, we're going to start with diet, because the foundational diet cannot be ignored. That said, people with depression and anxiety aren't always really super motivated to be eating healthy. We talked a little bit about folks that might be on a GLP-1 agonist that might
Right.
also be experiencing like, I don't really care what I eat right now because I'm losing weight. I feel okay. My doctor says my numbers look good. I'm not really motivated to eat healthier. Why should I be eating healthier? So
hmm
this is where we start talking about nutrient density. We start educating about the importance of feeding the microbiome with fiber and with polyphenols. And I always talk to my patients from the framework of eat the rainbow, eating colorful variety, and really rather than sitting there and focusing on how many calories did you take in, how many grams of protein did you have, how did you do in terms of getting in enough XYZ nutrient. That's a little pedantic for most patients, right? Most of them are busy people. They're not. I'm a nerd. I like that stuff, but they may not be into it. So to
Well, and
me,
it also might be off-putting in a sense of like, I don't have time for that, or
I don't
I don't
want to
remember
measure my
what I ate for
food, or
dinner.
you want me to
Yeah.
like start like putting it in an app. I'm not doing any of that, right?
hmm
But when you start talking about qualitative things, so the two kind of go-tos that I have, depending on the person I'm talking to, is I have them either. I talk about colorful food and how to build a plate that's colorful and then support it with some protein. And that usually gets us talking about eating a variety of fruits and vegetables. It gets us talking about increasing their fiber intake. And then I go, let's pair that with a protein. And then I just educate them on what a protein looks like, depending on what their typical habit, what they like.
Sure.
And to me, it's very much agnostic, right? Because it doesn't matter what cultural background they come from. It doesn't matter what their philosophy around, if they're carnivore or vegan or whatever, like there's something that I can talk about that is
hmm
relevant to their philosophy around food.
Sure.
And what I'm talking about essentially is the literature that talks about the more variety that we have in terms of our diet, the more color, the more phytonutrients, polyphenols, etc., that we introduce into the diet, that's signified by those variety of colors, the better we feed the microbiome. Remember how I talked about the different neighborhoods and the different little bugs that live in the different neighborhoods and how much of them we need relative to each other? That variety of color is one of the best ways to predict the variety and the volume of those healthy, good, commensal, good bacteria,
So we
right?
feed everybody in the neighborhood with multiple colors.
It's like a food program for
Right.
the microbiome, right?
Yeah.
So exactly. And the more diversity of color, the more diversity of microbiome. Super simple concept. It's
Mm.
very visually appealing. The prettier your plate, the better. I used to have a tool for my peds patients where I would have them fill in a rainbow, and like
Mhm.
every meal they would like fill in the color of the rainbow, and their goal at the end of the day was to have the whole rainbow colored, and the kids would get super excited and they'd be like, I gotta find a blue food, mom, I gotta find like a purple food, and so they'd get super excited about it. And then I realized their parents were really stoked on it, so I started doing the same thing with parents, and I just made it a little bit more adult. So rather than coloring in a rainbow, I started just telling them to start to pay attention. I gave them a tracker to pay attention to the amount of color that they're having
Hey,
throughout their
adults
day.
like to color too. Adult
They
color is
really
big right
do.
now. Yeah.
Exactly. So I just take the same. And honestly, sometimes I'm like, do you want the coloring version?
Yeah.
Because I totally can give that to you if you want to download that and
Yeah.
color it in yourself. So that 100%, and it serves as a because coloring is also supposed to be a great like stress
Yeah.
reliever.
Stressful.
So
Yeah.
two
Yeah.
for
It's
one
the
deal, right?
relaxation, well-being. Yeah.
And
Absolutely.
really visual takes us away from the calorie counting and the worrying about, am I getting enough
Yeah.
XYZ? And yeah, sure, I want to make sure you're getting enough protein because protein is super important for the production of those neurotransmitters as well, particularly complete protein that have enough of tryptophan and tyrosine and
Sure.
phenylalanine and iron sources and foods that contain zinc and things like, and B vitamins. These are all really important because those help shape and make those neurotransmitters that we need and help balance our blood sugar at the same time, which also can impact our mental health status. But at the end of the day, again, lowest hanging fruit, pun intended, is to make sure that they're just aiming for colorful variety and pairing it with a protein. And as they're
Well,
feeling better and more motivated, we can have deeper conversations about
yeah.
that.
And, Laura, I think that, this is no tea, no shade, but for the majority of our listeners, they're probably not trained dietitians like you, also a pharmacist. So,
Yes,
I think understanding that you don't have to be. It's the information you can share is minimal as keep it colorful, make sure it's got a protein in there too. And then if they master that and they say, I have colorful plates and I want to learn more, then connect them with a nutritionist, with a
yeah,
dietitian,
yeah,
have someone on your team that either is that or have a person that you partner with in your
exactly.
store that you say, okay, I've got a patient who they're ready to make some
Exactly.
changes and some
And
decisions.
and it doesn't have to be that complex. You can simply up level that to the Mediterranean diet. So if you're
Yeah.
comfortable talking about the Mediterranean diet, that's actually also been proven to be just as effective as medication intervention in improving mental health scores. So
Wow.
the Mediterranean diet, there's actually a trial from a few years back called the SMILE study that actually had a group of participants as a RCT trial. So there was a group that had the interventions alone and the group that had it with the Mediterranean diet, and it was modified specifically for this trial. And the
Mm,
group that had the Mediterranean diet intervention outperformed the other group leaps and bounds.
interesting.
So it's really like it is a truly effective strategy, but again, that might not be where they're at today.
Right, right. I mean, they may not be ready to talk about exactly what I should be eating, but to give it from a you know high level view, just say keep it colorful, add a protein. Here's what colorful means. I feel like after listening to what we just talked about, any pharmacist can do that.
Exactly.
Like that's super easy to do. And if you
Exactly.
don't feel comfortable going to the next step or having the next conversation, do have a partnership already formed to where you can send them to a dietitian and a nutritionist
Absolutely.
or whatever. I mean, offer a, your office space to a nutritionist to come in twice a week and meet with patients. You know,
Exactly.
yeah,
Exactly.
there's opportunities there for you to continue to build a service
Yes.
for your patients, and again, you still look like the winner as the pharmacist because you made that initial connection and then you passed them off to get more information. So
Absolutely. And I'm going to plant a seed here. I'm going to come back to it when I
yeah.
talk about supplements. But if they're not willing to make the dietary changes, there are supplements and ways that we can kind of like bypass that initial hesitation. And I'm going to come back to that. So keep in mind, even have the conversation, because I'm always a believer in having that foundational conversation with them, because you cannot outrun unhealthy diet. There's been studies that also prove that diets that are high in ultra processed foods, high in high carbohydrate, low fiber diets, low protein diets, all contribute to depression and anxiety as well. So we don't want to ignore that research, because we're we're leading with evidence here, but sometimes they're not ready for that. They just don't have the motivation.
Or the capacity. I mean, maybe they're still reeling with the idea that I'm suffering from depression and anxiety, or I'm going through this or whatever. So
I had a patient, part of her anxiety was feeling like she was never good enough and she never met her parents' expectations or her husband's expectations. So she refuses to cook because cooking is a trigger for her, because she's always worried she's going to mess it up, like that something's going to go wrong and she's going to mess it up. That's a real trauma. Right. Yeah. So I'm not going to, it's a vicious cycle, because then if she does mess it up, or somebody, gives her critique, or she doesn't like it, that's going to just make her less likely to try again. So until that's addressed at its root, me telling her, just try, let's see what happens, no big deal, is dismissive and frankly is not trauma informed. Right. So yes, we do always want to meet the patients where they're at. And sometimes they're ready for it. We want to give them the lowest possible low-hanging fruit option. There's so much that we can frankly explore in this conversation in terms of like the nutrient density and why Mediterranean diet works and all those things. But we need to also keep in mind that not everybody is ready for that. So let's start there. And then I think of the supplements as a way to bypass that, to get the impact, get them feeling better, get them past that. And then we can start having more meaningful conversations around diet and lifestyle. Yeah. Okay.
So diet is the first level, the cornerstone. So what would you say is the next step?
2 is going to be lifestyle. Again, I'm trying to simplify this conversation. Sure. So keep that in mind. So anybody out there who's like, she forgot to talk about it, keep this in mind. I'm trying to simplify it, because there's environmental factors. There's going to be stressors that patient can't get to, socioeconomic factors, right? There's a lot of layers to this, right? Trauma, like we talked about in that example, but just honing down on movement, sleep, and stress management, right? Those are really essential. What it looks like for that individual is going to look a little bit different, but essentially getting them into a routine that gets them on a regular rhythm throughout the day, that addresses their circadian rhythm, that we're ensuring that they are waking up at a regular time, going to bed at a regular time, and that their cortisol and their melatonin are offsetting each other. Excessive blue light exposure at night not only impacts our cortisol response and impacts our melatonin production overnight, impacts our sleep quality, is also going to impact our mood the next day. Not just because you didn't sleep well and you're cranky, but you're also going to experience altered mood as a result, and the shift in those chemicals, right?
And when you say blue light, I'm assuming you mean looking at your phone or your iPad before bed.
Yeah, I'm not going to make a lot of friends saying this, but scrolling on your phone.
Clarify.
Yep. Scrolling through the phone right before you're trying to fall asleep, falling asleep to the TV, having too many lights on at night even. All of that is stimulating blue light. Blue light sends signals to the brain that this is daytime, and it's very confusing to the brain. You know what you can do? You can listen to a podcast. So there's that.
That's right.
A little alternative, a podcast, an audiobook. Those are all fine.
Well, I hope we don't put them to sleep though, Laura.
I hope we don't put them to sleep. That's a very excellent point. But that's really important. Then countering it with blue light in the morning. So part 1 is limiting blue light exposure at least 1 to 2 hours before bedtime. I would say the longer, the better. And part 2 is getting blue light exposure in the morning. That means getting eyes on sunlight. Don't stare at the sun, but getting eyes on sunlight so that you are getting the blue light to the brain, and you're saying, hey, brain, this is what real blue light exposure looks like. Wake up. Let's get things moving, because we want cortisol to gradually rise. So it starts around 5 a.m. It gradually rises. It hits a peak at late morning, and then it's supposed to dip low enough around 4 p.m. where melatonin's like, okay, cool, let me come out now.
Time for me to take over. Yeah,
exactly.
Yeah.
And so those those are largely dictated by blue light and then red light exposure. And so another thing you could do is potentially, it's okay. Another thing that you could do is potentially use red light exposure. So there's like red light bulbs that you can use. And there's actually light machines that folks can use where it will automatically change the light in the room. And they can use a blue light in the morning and a red light at night. And that could help to reset their circadian rhythm.
Yeah.
That is going to go a long way in improving not only their sleep quality, but that is a form of stress response and stress support. Obviously, there's other things you could do. There's talk therapy, which is obviously kind of the gold standard when it comes to supporting patients who are on SSRI. But there are also other stress management techniques that you can talk to your patients about. Simple box breathing techniques, for example, taking a walk outside. I like to combine the morning light exposure with an opportunity to take a walk outside and to get some exercise, to get a little bit of movement. And if you have the luxury to be able to get into nature, so if they live near a park or an area that's grassy or has trees, the actual exposure to nature has also been shown to reduce stress and to improve stress response as well, and is a great way to manage mood.
Yeah. Wow. It's also a great way to get some pollen in the spring.
Absolutely. Very good point.
Good or bad, but
very good point.
No, I love that, and I love the idea of again, hopefully as pharmacists we're trying to give the information in those bite-sized formats, again, because our patients are not always ready to be overloaded with everything. But I love the idea of, hey, you can kill two birds with one stone. I always hated that saying. I don't think that's the best one I should say.
It's a little violent to birds.
Yeah, I feel like maybe I should come up with another one. Anyway, addressing two things with one by getting the cortisol and by also moving. And so I love the idea of doing that, brisk walk in the morning or exercise in the morning outside, especially, as we get better weather. But that's
a great takeaway. That's a great takeaway right there, is that if you can get them to avoid light at night, to wake up in the morning, get outside and take a walk, you've addressed sleep, you've addressed stress, and you've addressed movement.
Yeah, that's great. Yeah. Right? Easy peasy. Okay.
Easy peasy. So that allows us to now move into complementary support. So there's so many nutritional factors that impact our mental health. So keep in mind, we're going to kind of go through them. You don't need to do all of them all at once. Use your instinct and your understanding of the situation to sort of make that recommendation. But no, you have a ton of options on your proverbial shelf or on your bookcase or in your toolkit that you can pull out and use to support your patients. And sometimes that's going to be conditional. And sometimes it's just going to be like, you're going to come up with a protocol that you see works. And that is where, the fun of clinical practice comes in. So I'm going to go back and address what happens when you've got someone who's not willing to make the dietary changes, foundational dietary changes. What do we do? And I would recommend a medical food that has a good amount of protein in it, that might even have some polyphenols in it or some anti-inflammatory ingredients in it. And that there are some that also have a pretty decent amount of basic nutrients, vitamins, minerals that can be really useful. So a good example of that, one that I actually use often, is a product called Mitocore from Orthomolecular. And I use that one because it was studied specifically for people who have chronic fatigue. Chronic fatigue's hallmark is inflammation, fatigue, difficulty concentrating. They mimic a lot of the symptoms that you'll see in folks that have depression and anxiety. And the takeaway here, the ingredients are really going to be helpful, especially if you're using the protein form, is that you're going to get a protein in them. They can make it quickly into a shake. So it's super easy. They can either make a fancy smoothie or they can just mix it with water if they want. And then they're going to get things like magnesium, B vitamins, zinc, all the major, the main nutrients that they need to power their mitochondria, power their neurons, and it's got a few antioxidants, resveratrol, EGCG, etc. So I say that because there's a few different formulas that you can look at. Things like AG1, which is like that greens powder formula. There's a bunch of different greens products. There's things like whey protein that you can use, and you can combine them. And depending on the patient and what they're willing to do, you might find your favorite combination to recommend or a one go-to option, but that's essentially what you want to look for. You want to look for protein to get their day started. You want to look for some polyphenols, antioxidants, and then you want to look for a good balanced multi-nutrient that's going to be well absorbed. Because not all multi-nutrients like and most of our over-the-counter, common multivitamins don't absorb very well. They're actually also don't have a high enough concentration of most of the nutrients that we're looking for. So keep that in mind. They tell you, oh, I'm already taking a Centrum or a one a day. Just make sure that they are eating adequately enough that they don't need a more robust multi-nutrient. So that's my one go-to. Like if they do nothing else and they can at least do that, I can get them on a baseline. That's usually a great starting point. From there, fish oil or thinking about inflammation. So fish oil is one of the most studied interventions when it comes to depression in particular, but fish oil, omega-3s can be really helpful for improving inflammation and therefore improving mental health. Fish oil can also change the microbiome. It can have a positive effect on the microbiome as well. This is actually more recent research. So a high quality fish oil can be a really great intervention. This is where I'm pretty staunch about a high quality because if there's contaminants, heavy metals, if it has been processed in a way that alters the quality of the fat and denatures it, or if it is in transport, it's getting overheated, etc. That's going to have a very, not only it's not just going to neutralize that fish oil, it's going to actually make it more inflammatory. I'm very this is the area where I'm like, if they're going to splurge on anything, this is what I want them to splurge on. Everything else, you can kind of usually find a low cost alternative, but this is the one that I'm pretty bull on. Like we have to have a high quality fish oil. So that's one kind of like pearl to kind of keep in mind. And if you're noticing somebody's taking a fish oil and they're not getting the benefits, explore whether or not it's a high quality fish oil. Exactly. If they're getting fish burps from it, you should never get fish burps from it. And that's a low quality fish oil right there.
Yeah. That's good feedback.
Yeah. The third intervention, which is I feel like pretty baseline, is magnesium. Magnesium is a great go-to. Honestly, most of us are deficient in magnesium. Most of us can actually use a little bit more magnesium. Depending on the form of magnesium, we could see different benefits. So I usually recommend a magnesium glycinate or a magnesium threonate when it comes to depression and anxiety. Glycinate could be a little bit more relaxing. Threonate has better absorption neurologically, so you have a more direct brain effect, which can be relaxing, can also support sleep, can also support anxiety, etc. So either of those, threonate tends to be a little bit more expensive. So glycinate tends to be a little bit more affordable, and I can kind of play with the dosage and see what's working for them. And that to me is an important baseline intervention for most people, especially though if they're experiencing insulin resistance, they're pre-diabetic, diabetic, they're on that cardiovascular risk spectrum, super important intervention. And I find it very useful, again, if they're experiencing sleep disturbances, either because of their mental health or vice versa.
Yeah.
The next one is vitamin D. There is a very strong connection between low vitamin D and increased risk of depression in particular, and to a smaller extent to anxiety. So making sure that we're maintaining adequate vitamin D levels. It's not the main reason that we experience seasonal affective disorder, but is a contributor to seasonal affective disorder. So making sure that they have adequate levels, I call adequate over 40 on their blood work. So making sure that we're checking their blood work and seeing where it's at, and then dosing them appropriately to ensure they get optimize their vitamin D levels.
Okay.
Magnesium helps to optimize that vitamin D level, by the way. So we go back to magnesium, and I usually pair vitamin D3 with K2 for better absorption and utilization and conversion of that vitamin D.
Okay.
That's
a lot.
That's a lot. I've got one more for you.
So much. This is so good. Okay.
One more for you guys. The last one I'm going to mention is probiotic. Okay. There's a ton of different probiotics on the market. There is some evidence that suggests that the use of probiotics can help to improve mental health, specifically anxiety and depression scores tend to improve. However, it is more strongly associated with certain strains of probiotics. So where you might see a general probiotic, one that has multiple strains, do okay with some people, especially if they have a pretty significant dysbiosis.
Mm-hmm.
If you really need a targeted approach, then you need to be more strain specific in how you prescribe that probiotic. So the species that's most associated with particularly depression is Bifidobacterium longum 1714. That specific strain of bacteria has been shown to be really effective or really helpful for improving depression and even sleep disturbances associated with mental health status. There's a particular product that I know has this in combination with saffron. And I want to highlight this for two reasons. Number one, we have nightmares about St. John's wort because I remember being warned so much about all the drug interactions with St. John's wort, right? We all remember, it's absolute no-no to give St. John's wort with anybody who's on an SSRI. So we all know that. However, what St. John's wort also does is it acts as a natural SSRI. So although in a person who is on an SSRI, or maybe on multiple medications that may not be an option, St. John's wort is a great option in those cases. One with less drug interactions and less risky is saffron. And saffron as an extract has been shown to be as effective as not necessarily new generation SSRIs, but old antidepressants. So things like trazodone, mirtazapine, et cetera, has some really good benefits in terms of mood regulation. And there's a particular product that combines the Bifidobacterium longum with a saffron that has been shown to target specifically serotonin production in the gut. First warning, if they are on an SSRI, be mindful of that interaction.
Sure.
Second warning is, not everybody necessarily does well with that on its own, but I have found different combinations of those probiotics to be helpful, but the most effective in my experience has been the strain-specific probiotics.
Sure. Wow. Well, this is so good. I want to try to debrief a little bit and just make sure that I know our listeners are probably about halfway through. They decided to pull out a pen and paper and take it because you were giving so much good stuff. But some of them may be in a position. I hope if you're driving, you're not taking a pen and paper.
Yeah, please don't take notes if you're driving.
Yeah, please don't do that. Just listen to the episode again. But I want to try to debrief and kind of do like a summary if you
yeah, let's do it.
So basically just kind of starting over, and this being a 2-part episode series, the first part where we really kind of dug into the gut and the brain they chit chat all the time. There's multiple pathways in which they discuss things. They affect the two of them together affect our mood, our cognition, neurological health in general. There are a lot of we also broke down microbiome in the first episode, and so we talked about exactly what that is, the multiple neighborhoods that are involved in that process, right? And then we talked a little bit about some of the medications that commonly are kind of interacting with that, and things to kind of be on the lookout for. And then you gave us these 3 buckets at the end of the first episode, which we teased and made you come back and listen to the second episode. And so just quickly remind us of just the overview of those 3 buckets and just like the quick take home from each as just like a summary.
Yes.
Is that doable?
So I'm going to start with, let's try. Let's see
if we remember how we put them in order, right?
I remember because this is how I organize things. I think about them from what's the most kind of high level awareness building technique for our patients down to what's going to be a quick, easy consultation point regarding their medication. And then 3 gets into what typically is a little bit harder, longer, more protracted conversation, which is going to be diet and lifestyle.
Depth and a little bit more of you're really changing something. So
Exactly. It takes a little bit more behavior change and a little bit more coaching around that. And that might open up opportunities for referrals to other clinicians that might be doing that deeper work.
And quite frankly, it takes a little more of them feeling comfortable with you and growing the relationship and being communicative. And
so building that rapport in that way. So if you kind of follow that, roadmap, you're also building that rapport and strengthening that communication, building trust. So bucket one are those counseling opportunities where they either come to you because they're having depression symptoms, are considering starting an SSRI, they're on SSRI, or they have questions about their SSRI.
Mm-hmm.
Flip side of that is that they have GI issues and they have questions about their GI
Right.
health, the symptoms they're experiencing, or medication that they're taking and its impact on their gut.
So either we're thinking about starting it, it's not working, I don't see the effect, or I'm having a terrible side effect, or I'm having an annoying side effect.
Or you're filling it and you're saying, do you have any questions? And you
Sure.
go, I'm curious, are you
Right.
experiencing any of these symptoms? Right.
Right.
Or I happen to see that you're picking up a medication,
Mm-hmm.
an over the counter NSAID, right? Or you also have this other medication, you have this oral contraceptive.
Mm-hmm.
Are you aware? Are you interested in learning more about this interaction?
Yeah.
Are you interested in learning more about this connection?
And
Right?
sometimes it is important to make the connection for them. Like you said earlier, I'll use the example. I'm currently going through some vein procedures. And
Mm-hmm.
when I first went, I didn't think it was that big of a deal. And the doctor said, "Are you experiencing this?" And I was like, "Well, yes, I am." And he
Right.
said, "It's because of this." And so it's important sometimes to make the connection for them,
Exactly.
because then it is a bigger impact and you're going to be able to really impart information.
And it's not their job to make the connections.
Right.
It's our job to
You're not
help them
here.
see those connections.
Yeah.
And when they are saying, oh my God, I feel crazy because XYZ is happening. But when I looked online, this wasn't a side effect of this medication. And you can say, you're not crazy. Here's the explanation. And I feel like so cool when I can help them see that connection and they think I'm so smart. And now I've got their attention and I can educate them about how to take it to the next level.
Yep. And you're building that rapport and it's getting stronger and stronger.
Exactly. So that opens up the opportunity in stage 2 when they're feeling a little bit more open and ready to have that conversation. They might be coming more proactively with questions, or now that you've built that rapport and you're on that same page, that they go, hey, I read the article that you sent me, or I, listened to that podcast that you recommended on this topic, or whatever it is. And they go, hey, I would love to know if there's something I could be doing or I should be thinking about because of this medication. Or they're asking you, and you can start to say, okay, here are some of the side effects or the impacts of this other medication that you may not realize is impacting this, or some of the symptoms from this other diagnosis that you don't realize is connected to this. Because in our allopathic training, we do a really, really good job of breaking things down and putting them into buckets, right? We have hyper specialties. I always have I have a colleague who is a nephrologist. Think about they are a specialist in one of the tiniest parts of an organ that's already a specialty. You know what I mean? Think about the sort of depth of knowledge that they have on just one piece of the body.
Yep.
We're really good at that and compartmentalizing and understanding how things work at a cellular level. What we're not as good at, and I think where we're potentially there's a gap in, and our patients are suffering the consequence, is in making that whole connection and helping them understand that there are relationships between these. Are not silos. Your body doesn't go, well, that's a heart thing. I have nothing to do with that. I'm the gut over here, right? That's not a thing, right? It's all connected. And I think it's our job to help them understand those connections. And again, that really is going to help set you apart as that expert. And I think as pharmacists, we are already kind of positioned as that whole person care clinician because we have to know a little bit about everything. I don't care if you're an ER pharmacist. I don't care if you have a specialty or peds. You still have to know a little bit about everything, because you can't be filling a prescription for a GI med and somebody's like, here's your antidepressant. You're like, I can't fill that. That's not on I only do GI, right? You have to know a little bit about everything. So I think that helps us make those connections. And I think we can use that then to help support our patients. And that brings me to bucket number 3, is when they are ready to actually take steps and they're looking for something that they can do. Number 1, gauge their interest in changing their diet. I think first and foremost, I'm biased. I'm a nutritionist, so I believe that diet kind of leads in that. But it might not be diet. It may not be big changes. It might be just talking about eating the rainbow, or talking about, are you getting adequate amounts of protein? What's your appetite even look like? And what are you ready to eat today? Right? What are you willing to do? And maybe what they're willing to do is have a shake in the morning, and that's all they're ready for.
And that's okay.
And that's totally okay. That's an awesome first step, because you know what they weren't getting yesterday? 30 grams of protein in the morning, right? So start where you can. And then from there, you can have a conversation about their lifestyle changes. And to me, the most impactful thing is focusing on circadian rhythm, because with that conversation about blue light or about sun exposure, wherever you want to start that conversation, you could get them up in sunlight, getting in some exercise, getting some fresh air, and moving, right? And so you're addressing sleep, stress, and movement in one shot, in one activity. It could take them 5 minutes. Sometimes I tell people, I'm like, I don't care if you just go get the mail and come back. That counts. Totally counts.
Because what it'll eventually do is it'll extend, and then they'll walk around the neighborhood. And
it's like, I put my sneakers on. I guess I'll go walk down the block. And then they get down the block, and they're like, I guess I could go a little bit longer. It was such a nice day. And so hopefully that builds and that grows. And as they start to feel better, they get more motivated, and that drives that behavior change and really reinforces that. And then from there, you can add supplements, right? Like you're already talking about, we're talking about vitamin D. That's a pretty kind of low-hanging fruit. Fish oil, multi-nutrients, combining a multi-nutrient with a protein shake, making it really comprehensive in one shot, thinking about sources of antioxidants, high quality nutritional support, like a good, even a greens formula that's going to do it all in one shot. That we're going to hopefully get better absorption out of. And then we can also support them with magnesium and a probiotic. Ideally, I would suggest a strain-specific probiotic. But again, probiotics, in my opinion, are cost prohibitive for many. A really good one often is very expensive. Same with fish oil. And so if I had to choose and I can get them to eat fiber or eat polyphenols or take a antioxidant formula, then I might opt for the fish oil and then maybe just feed their microbiome. But, that's a decision you're going to have to make depending on their symptoms, their budget, and what they're willing to do.
It's for the patient.
And they might feel drawn to one versus the other. There's a lot of conversations on social media about the microbiome and probiotics, so they might be more motivated to take that. So it really depends.
Or I'm willing to splurge on that because I've heard it's really effective.
Exactly. So let's take advantage of the marketing and sort of just follow their lead.
Yeah. Well, Laura, this has been so insightful, and I really appreciate you giving your time for 2 very informative episodes. So I think we didn't really end the first episode with the game changer like I like to do. I think it was obvious what the game changer is. It's that the gut and the brain talk, and everybody needs to be aware of that. But what would you say is the overall game changer?
So the game changer for me is being the healthcare professional on their team that is willing to have a conversation with them that helps them connect the dots about whether it be the gut-brain connection, about the connection to diet, about the options that they have in terms of how impactful a habit change or dietary change or even a supplement or nutraceutical can have on their health. And really just being their advocate, being that person that they can trust to go to and have that conversation with, where they feel safe, they don't feel judged, and they know that you are going to steer them in the right direction. You're going to use evidence-based thinking to drive that, and that they can trust that they can come back to you and say, hey, this worked, or this didn't work, or what else can we do next?
Yeah. So good. Well, Laura, thanks again. It's been so great to have you. And we've worked on a few projects together here and there, but we've never had a chance to see each other face to face until today on the episode. So it's been great to get to know you and talk with you. So thanks again for taking time out of your schedule. We really appreciate it.
Thanks. I appreciate you, Josh. I appreciate this opportunity. And for those of you who stuck through both episodes, thank you so much for listening. I hope it was valuable.
Clearly, you can tell that you're passionate about the topic and very well versed. So thank you again.
Thank you.
If you're a CE Plan subscriber, be sure to claim your CE credit for this week's episode of Game Changers by logging in at ceimpact.com. And as always, have a great week and keep learning. I can't wait to dig into another game-changing topic with you all again next week.